All right, so today we're going to talk about gout. Gout, okay? We're going to talk about gout. Please don't confuse gout for goiter, the goiter. It's not the same thing. Gout is a biochemical disorder. That is, it's a biochemical problem. This one is basically due to iodine deficiency. Do you understand? Gout is not iodine. It is goiter that is what? Iodine. So for gout, the main problem with gout is that there is excess waiting uric acid. There's excess what? Uric acid. That is the first thing you have to write. So I said gout is a biochemical disorder. It is a biochemical disorder characterized by what? By what? Hyperuricemia. That is to say, excess uric acid in the blood. So you have high levels of excess uric acid in the blood. Hyperuricemia. Mia means blood. Alright. Now, due to these high levels of the uric acid in the blood, it is going to precipitate in three main places. One, it can precipitate in soft tissues, right? Soft tissues like your kidney. If it precipitates in the kidney, it will lead to what? Kidney stone. So let me just put a little kidney here, just for you to get the picture. Just picture kidney stone there in the kidney like that. Okay? So, caused by gout. When it precipitates in soft tissues, it will cause kidney stone. Then there are some regions in the body that have low temperature, like your toe, your big toe. If it accumulates in that place, we call it tophi. Tophi. A bit tougher, anyone. Okay? Then again, in your synovial joint. If it accumulates in your synovial joint, it will cause what? Arthritis. So when you see a person having arthritis, a person also having kidney stone, then you check the big toe of that patient, then you see something like accumulation of all these swellings, the tophi. You get my point? That one, you should be thinking of gout. Do you understand? So what is gout? Gout is a biochemical disorder characterized by hyperuricemia, excess of uric acid in the blood. When this uric acid accumulates, it can precipitate in three places. Soft tissues like your kidney, it will lead to kidney stone. Low temperature region like your big toe, it will lead to tophi. Then in your joint, it will lead to what? Joint arthritis. Alright, now what are the causes of gout? What are the causes of gout? The causes of gout, there are two major types. We have the primary cause and we have the what? The secondary cause. Now, anytime you think of primary cause, just know that there's an enzyme deficiency. There's an what? Enzyme deficiency. So the main thing about primary cause is what? Enzyme deficiency. Enzyme deficiency. That is the main thing about primary cause. While for secondary cause, it's usually due to excessive breakdown. Excessive what? Breakdown. If there's an excessive breakdown of purine nucleotide, it will cause secondary gout. Excessive, let's say the turnover rate is high. The turnover rate of nucleic acid is high. It will cause secondary gout. But the main one I need you guys to focus on. The main one I need you guys to focus on is primary gout. What causes primary gout again? I said what? Enzymes. Okay? Enzymes. What are those enzymes? The first one you need to know is what? If you are having a dysfunctional what? PROPP synthetase enzyme. So for example, that first enzyme in the pathway, if that enzyme is defective, I'm coming, let me see if I can, okay, I will just be using this one side by side, okay? Try to get the main gist where. Let me see if I can see my blue biro, okay. Basically, just take note, this enzyme, if it's defective, the person will come down with primary gout. So that's what we have here. Are you seeing it? PROPP synthetase enzyme. If it's defective, the person will come down with primary gout. Again, another enzyme, the second enzyme there, PROPP glutamine amidinotransferase. If this enzyme is also defective, the person will come down with what? With primary gout. Okay, the person will also come down with primary gout. So that is it. So look at the two enzymes here. Are you seeing this one? This was the one we did for the regulation of purine. This one is enzyme 1. If this enzyme is defective, primary gout. If this enzyme is defective, primary gout. Can you see it now? So in a case whereby these enzymes are no longer sensitive to feedback inhibition, are you seeing the things that can inhibit the enzyme? All these ones here that are going up, they are capable of inhibiting the enzyme. Can you see there? Alright. If these two things are no longer sensitive to feedback inhibition, it means that this enzyme will no longer be inhibited. It will keep on producing what? Producing the purine nucleotide, your AMP and your GMP. on a normal day before, when we have high levels of GMP and high levels of AMP, they have the ability to inhibit these enzymes. But in a case whereby these enzymes are not dysfunctional, they are not working well, they're not responsive to inhibition, they will keep on synthesizing. So you are going to have high levels of AMP, high levels of GMP. Do you understand? And when you have high levels of this nucleotide, they will be broken down, and when they are broken down, the person will have waiting uric acid, because the end product of purine nucleotide breakdown is what? Uric acid. So let's come back to this place again. What do I say are the causes of primary gout? Dysfunctional, please. It's not lack of the enzyme. It's what? Dysfunctional. The enzyme is what? Let me use the other barrel so that you see it well. The enzyme is what? Dysfunctional. Dysfunctional enzyme. Dysfunctional. Another one again, dysfunctional PRP synthesis. And lastly, if you are having a dysfunctional glucose 6-phosphatase, this one is very, very important. Somebody having a dysfunctional waiting glucose 6-phosphatase, or the person is having lack of, let me put it well. This one is lack of what? Lack of what? Glucose 6-phosphatase. So if somebody lack glucose 6-phosphatase, the person will also have gout. Now, what are the biochemical bases? So what is the outline you're using for your gout if you're writing tomorrow? 1, introduction. So you write introduction. 2, the causes of gout, primary and secondary. I get my point. 3, the biochemical what? Basis. Biochemical basis for the gout. Can you see this thing? All right. So the biochemical basis, I've already explained it. So due to a dysfunctional, are you seeing? Due to a dysfunctional PROPP synthesis enzyme, the enzyme is no longer what? Sensitive. It's no longer sensitive. It's no longer sensitive to what? To feedback inhibition. So even if those things are going back to inhibit it, they can't inhibit the enzyme again. So the enzyme will keep on functioning like that. Okay. So it will not lead to excess. So the enzyme there will be excess production of what? Of the purine nucleotide, like your AMP and your GMP. Now, when you have high levels of AMP and GMP, they will be what? Catabolized down, and the end product will give you what? Uric acid. So that's the reason why there is hyperuricemia, and this one will cause gout. And we said gout is what? Basically hyperuricemia. When a person is having high levels of hyperuricemia, characterized by kidney stone, tophi, and joint arthritis. Okay, so that is it. You will see use the same pattern to explain for this one. Okay, so just to recap it, in the next video now, I will do for this one separately. Because this one is a possible exam question. They can ask you to link why is it that somebody that lacks glucose 6-phosphatase will have gout. Possible exam question. However, let's just recap this thing quickly. What is gout? A biochemical disorder characterized by what? Hyperuricemia, such that this excess of uric acid accumulates in 3 places. Soft tissue like your kidney, it will cause kidney stone. Low temperature region like your big toe, it will cause tophi. Your joint, synovial joint, you cause arthritis. What are the causes of gout? There are 2 major causes, primary and secondary cause. For a primary cause, is due to enzyme deficiency. Secondary cause, excessive what? Breakdown, excessive turnover of nucleic acid. Now, for the primary gout, the enzymes are what? PROPP synthesis if it is dysfunctional. Another one again, PROPP glutamine aminotransferase if it is dysfunctional. Then lastly, we have lack of glucose 6-phosphatase. Then I now explain to you guys that this is what I now explained, that if you have this enzyme that is dysfunctional, it is no longer sensitive to feedback inhibition. It will keep on synthesizing AMP and GMP. AMP and GMP will definitely be catabolized down to form uric acid. Then you are going to have high levels of uric acid in the blood, hyperuricemia, hence gout. Alright, so this is for the first video. We'll do the second one now.